6:31 this morning. It's supposed to be one of the most exciting moments in a family's life, welcoming a new child. But not every mom experience is a smooth one.
Our Two Americas series aims to show you the America you know and the one you may not. In our latest installment, KSHB 41 News reporter Dan Cohen tells us the stories of local mothers who did not have the perfect pregnancy and what one organization is doing to help families in the metro right now.
Monique Young is the mother of two. She vividly remembers her first delivery.
I get to the hospital and then the doors are locked because it's 2 in the morning. So I'm just like me and my husband were like, what do we do here?
She said she didn't feel prepared, but for her second delivery, she had a doula by her side.
It's hard to make those decisions on your own. So having somebody next to you and kind of giving you that advice and that support is really helpful.
Deja Lewis is the mother of 4. She told us she had near-death experiences during 2 of her pregnancies.
I had a postpartum hemorrhage the first time and just got out the bed and fell to the floor. And if it wasn't for one nurse listening to me, I would not be here. The woman literally kept me from hitting the ground when nobody else was listening.
These are just 2 stories of many in our community, affecting many mothers and their children. Nurture KC has taken a closer look at local maternal and infant health.
There has been rightly a focus on infant mortality over the last several years, but you can't separate mom's health from that. They are absolutely connected, and that bears out in this report. And certainly for our Black mothers, their circumstances are considerably worse than white mothers.
That report covers data from 2021, and Nurture KC says it found a striking result.
The numbers don't lie, and what we saw was that in the first trimester, which is critically important, only about 50% of our Black moms had access to prenatal visits during that time.
Nurture KC's 2021 data shows Black and Hispanic maternal mortality rates rapidly outpaced those for white mothers in Kansas. In Missouri, 2018 statewide data shows similar trends among Black and white mothers.
We provide diapers.
Marcella Metcalf is one of Nurture KC's community health workers, focusing on Hispanic mothers.
The major issues are access to healthcare, transportation, lack of the providers knowing where these mothers are coming from, and they need to be more sensitive and culturally aware of what's going on and how to treat these women.
University Health OBGYN Dr. Tracy Johnson says she sees these problems regularly in clinical practice.
We're not meeting the patients where they are. We tell them that we want them to have 5 appointments, but then there's absolutely no way they can do this because each appointment's 2.5 hours.
Dr. Johnson says providing mothers with the resources they need for a successful delivery and long-term health requires financial and human investment.
We need double. Everyone needs double. Every hospital in this city needs 20 cultural health navigators to meet the patient where they are and plug and play.
Bibi, ¿cómo estás?
Hola, bien, ¿ya está Marcela?
Which is what Marcella does every day at Nurture KC's office.
I was actually certified to be an interpreter just because of that, because I needed to get that certification so I can call with my participants, make appointments, follow up, call the hospital, and see what's going on with their health.
But phone calls and supplies can only go so far.
In both Missouri and Kansas, there is legislation pending that would extend Medicaid eligibility for pregnant women to 1 year postpartum. Currently, that cuts off at just 60 days in both Kansas and Missouri.
It's one solution of many to make sure future healthy moms like Monique and Deja can start their lives as mothers on the right foot.
We have to be on top of these type of things and really get support for people in the community, because again, who else is really going to have your back and kind of know what you want?
This can very well be you, your family member, and everybody, and equitable health care for all is important.
In Kansas City, Dan Cohen, KSHB 41 News.
Dan, thank you. Deja Lewis told us she's taking her experience and turning it into a positive and constructive experience for others in the community.
Yeah, she's become a community health worker and advocate for other moms, making sure they have the resources they need to have successful deliveries and strong long-term health outcomes.